Hi, attendees. We will begin our webinar in a couple minutes. We're waiting for our attendees to log on, and if there's any technical difficulties, they are able to figure it out. So we will start approximately at 4:02. All right. Hi, everyone. Welcome. It is 4:02. So we're still waiting a few more attendees to join before we start. I did say 4:02, but let's give it one more minute. Welcome, everyone. We will start the webinar now. We have waited for a couple minutes, and I do see people signing on. So thank you and welcome. So we appreciate everyone for taking the time to join SGDM's webinar series. Today's discussion will be centered around emergency preparedness and staying vigilant so we can all safely get through this pandemic together. Our speakers will also touch upon strategies to help property owners, residents, professionals in the industry, and as well as exploring new or existing plans, policy, and procedures. Emergency preparedness has been a long-standing pillar for SGDM. As a contracting firm specializing in seismic retrofit, we believe in having an emergency plan ready. Our goal for these series of webinars is to inform and educate the community of San Francisco. This webinar will be recorded and will be shared on our website, sgdmllc.com. Please feel free to reach out to us if you should have any questions. So this is our website, and underneath on the bottom, you can see our previous webinar that we had about a couple of months ago. So this, so attendees, the Q&A feature will stay open throughout the webinar. So feel free to submit questions anytime during the session. You can do so by using the Q&A button at the bottom of your Zoom window. The SGDM team will be monitoring incoming questions, and our speakers will address the questions during the last 15 to 20 minutes. I want to take this time to thank our speaker for taking their own time of their busy schedule to lead today's discussion. The first speaker I would like to introduce will be Victor Lim. He has been with the City and County of San Francisco since 2009 and is now working with the Department of Emergency Management, where he serves as the External Affairs Officer and the COVID Command Center API Outreach Campaign Manager. Over the past 9 months, Victor's focus and dedication has been centered around a topic we all are facing globally, the novel coronavirus. The next speaker will be Dr. Sunny Pak. So Dr. Sunny Pak from the San Francisco Department of Public Health, he has been working tirelessly throughout the pandemic to debunk coronavirus myths and educating the community about this virus with accurate information. As the director of Chinatown Public Health Center, Dr. Pak will provide us with in-depth understanding about the COVID-19 and what we can expect in the upcoming months. Our next speaker will be Norm from BanCal. Norm started his real estate career by assisting clients with acquisition and disposition of their real estate assets. By starting on the landlord and owner side of the market, his opinions on market strategies were formed by the specific need of an investor client. Having 10 plus years of leadership roles with BanCal, Norm has translated his skills to develop procedures to create efficiency with lease-up and general operations of their clients' properties, and has helped many of them streamline operations to their financial benefits by identifying specific area to positively impact their bottom lines. As part of BanCal, Kelli Smith she is a San Francisco native. She has been in the real estate industry since graduating college. Her extensive experience has led her to venture into property management in 2010. Since then, she has built an extensive portfolio of rental properties and has handled and oversees the day-to-day operations. She is diligent and in her dedication to her owners and to keeping their investment strong. She is deeply committed to serving the community and does volunteer work with many organizations. And our last but not least speaker, Chief Ken Cofflin. He has moved to San Francisco for college and has found his passion in pursuing his career, which contributes to him and his wife living and raising their children in the Bay Area. We would like to congratulate Chief Ken Cofflin on his recent promotion to Assistant Fire Marshal of SFFD. And we will begin our presentation with Victor.
Great. Thank you so much, Julia, and also George, for inviting my department here today again. Honored to be here for the second time these past 2 years. So as we all know, we have been, as a city, responding to the COVID response, novel coronavirus. And actually for Sunny Pak and myself, we've been dealing with this since January. So more importantly, I think with our audience today, want to focus on how we can protect ourselves a lot for the industry professionals, for the tenants, for the folks that you work out there. Because right now, we know that there is a third surge with COVID-19. And we're gonna see, if we do not control the spread of COVID-19, that the capacity for our ICU beds and acute care beds is gonna be gone before the end of this month. And by January, we're going to be in a very dire situation. And so what we've done is right now, many of the city departments have sent staff over to the COVID Command Center now at Moscone South. And for a lot of folks that are out there, if you have seen the posters like the ones behind me right here, if you need any of it, I actually have a link that I put up there to Julia, and she can share in a little bit. And if you want any of the flyers for the properties that you're managing for your businesses, you can pick it up at 747 Moscone, or you can order it online and we can have it sent to you or find a time for you to come pick up. Now, several things we want to focus on, right? One is the vaccination that we just saw come out yesterday. And I'll let Dr. Pak talk more about it, because the first vaccination that we're administering right now is the Pfizer vaccine, but Moderna and other companies are also looking into it. We know a lot of the healthcare workers, the first responders, like Chief Cofflin is going to be vaccinated probably before me, and Dr. Pak probably before me. And also the testing that we've had throughout the city. And so number one, if you want to get tested, first of all, if you do have insurance, we always encourage that you should reach out to your primary care provider, be it Kaiser, CPMC, Sutter Health, because if you think you're symptomatic, first of all, the most important thing is to isolate and then to contact your PCP to find an appropriate time to get tested. We also have testing sites throughout the city, and we're partnering with Color. Their results are pretty good within 24 to 48 hours. Let's say at the Alameda Farmers Market or at Pier 30 are two examples of sites that you can either book online or do drop-ins or even walk-ins. And so, but be reminded, testing is not a way to get out of coronavirus. It doesn't mean you won't, that you're, let's say, negative now. It doesn't mean you're negative forever. So the precautions that we keep saying, and you'll hear Sunny Pak say this, is the social distancing, the masking, and also the washing of hands is very, very important. Now, focusing on the audience right here, I know I have a lot of friends that are in the real estate construction industry, and we see that perhaps a lot of our folks are in contact often with the public, with your clients. And so more, if they're asymptomatic and you catch it, sometimes you're strong, you have no symptoms, and you bring back home and you give it to maybe grandparents or young children, and that's very bad because COVID can be pretty deadly for people that are young or have a compromised immune system. We are also reminding people that ventilation is very, very important. That's why right now, with the upsurge of cases, we know it's sort of semi-airborne. But if you're going to see a property, try to make sure that you can get a draft going on and to make sure that there's ventilation and reduce the time that you have to expose yourself to your clients. Make sure you're masked. That's always the good thing. And again, like right now, we see a lot of communities out there that still think if they're okay, they don't have to get masked. That is solely like not the right way to do it. So with all of this, this is a high level. I want to leave more time for people to answer, to ask questions. I'm going to pass it on to Dr. Pak, and hopefully this lays an overview of some of the things that Dr. Pak is going to focus on. The floor is yours, Dr. Pak.
Okay, thank you very much, Victor. Can everybody hear me? Hear me okay? Yeah? Okay, great. So thank you very much for the invitation to have this opportunity to speak with you all. Hopefully, some of this information you may or may not know, but I'm just going to start from an overview of our current state of infection. As you see on the slide right here in front of you, this the entire California, most of the entire California is purple now, purple tier. What does that really mean? Basically, when a particular county has reached the ICU capacity of being less than 15%, it becomes basically purple. And that's a designation from our Governor Newsom, which is the highest level at which in that particular county of the infection rate. And why is ICU bed important? As you all may know, I mean, basically it's the place where if people have respiratory distress that basically they cannot maintain their level of oxygenation at a level that can sustain life, they have to go to ICU. So that's why that is a good measure of how much we can take care of these patients. And so as the trouble with this particular map is that the reason why I'm showing this is basically oftentimes when we in the inpatient side, hospitalization, and the patient needs to go into ICU, if we run out of capacity, oftentimes what we would say is, hey, maybe we can transport this patient quickly to a nearby county, maybe they would have a bed. So that can be done during normal times, but as you can see here, if that were to happen in San Francisco, there is nowhere else to send people to, because surrounding us, in fact, it's actually a lot worse. So in the Bay Area region, it's around 17.8%, which was last week, and right now it's actually decreased a little bit more. In San Joaquin Valley and Southern California, it's much worse. Some of the areas within those places literally do not even have hospital beds or ICU anymore. So it's very, very dangerous. So I want to say, let's see, how did we get here? And I'm trying to have control of the slides, and I can't seem to have control. Oh, there we go. Okay, great. So this is what Victor was saying about our third surge. And if you look closely at the particular tip of that particular, the last bit of that graph, we basically around the Bay Area, or at least in San Francisco, is at the highest point. We have never seen so much hospitalization within San Francisco, even though in terms of in the entire country, we are relatively one of the lowest, I guess, places where it's being have patients being hospitalized per capita, but nevertheless, it's still the highest. So, and the rate at which we're seeing it kind of rise is it's literally extremely remarkable, and it's very, very worrisome. So, how did we get here? As you can see, we pointed out right there at Thanksgiving, and right after Thanksgiving, there's an immense surge. So as you can see, during July and August, when we were actually really doing well, in fact, we were one of the counties where we were at basically yellow stage, and then eventually we creep up, and it just exploded up really, really quickly. And that has very much because of traveling and Thanksgiving. I know you probably hear in the news that people are traveling quite a bit. And I myself, literally yesterday, witnessed how easy it is to forget about social distancing. What we did was at my own clinic, we definitely canceled our usual holiday celebration. We were going to have some kind of a lunch or some kind of luncheon, but instead what we wanted to do was just simply pass out some gift bags. And on our way to pass out gift bags, what we didn't remember was we asked folks, oh, what would you like to choose? And when they all kind of came in, basically, and then people were taking pictures, social distancing just went out the door. So even with us as medical professionals, and we're trying to be very vigilant, whenever there is something that we're doing to celebrate, when we're amongst friends and we let our guard down, it's so easy to let our guard down. And so I had to continuously keep reminding folks to social distance. And basically that's what we're seeing. The other thing is the hospitalization rate usually lags about 2 weeks behind infection. So what we're seeing right now is the result of infection that happened 2 weeks ago around Thanksgiving time, right? So that's why right now what we're trying to say is be really careful and continue to be vigilant to do all the things that we're reminding folks week after week. Wear your mask, stay 6 feet apart, wash your hands, stay home when you are ill, and all of that. It is to prevent this from happening. So literally, our fate in the future is in our hands, and there are some projections of what's happening here. We ran some projection numbers about 1 or 2 weeks ago, and we saw that, let's say, if we don't change our habits and we continue to do what we've been doing and not wear a mask, not being careful, what we project is that there's going to be at least additional 1,410 hospitalization, at least, and it's going to peak around at least in February. We're going to have additional 517 additional deaths in San Francisco, and this entire pandemic is going to be much longer. So right now we're at about 135 hospitalization at this point, and if you can imagine looking at that, there's basically 10 times that much hospitalization if we do not watch what we're doing. Now, if we were to watch what we're doing right now and we become much more vigilant and keep our distance, wear our mask, it's a very different picture in January. In fact, the peak of the hospitalization we predict will basically happen next week if we just are able to bend the curve. The median hospitalization to be about 200 hospitalization, and that's about it at that peak. And we might expect 70 additional deaths. Not that it's good. Any kind of death is not a great thing, but at least compared to 517 additional deaths, it's a huge difference, and it's a shorter duration, right? So the question is, how do we get here, right? And we are talking about vaccines being the perhaps as a savior. Well, vaccines are not going to work, and I'm going to talk about that a little later on. Why vaccines is not going to be enough right now. In fact, it's going to be too late. It's actually too late for this particular surge because it actually takes some time for it to work. But let's turn around and, before I get to that, talk about how COVID-19 is transmitted. So just as Victor is saying, there is some evidence that it is airborne. Mostly it's by respiratory droplets. And I've sent a link to Julia about how the importance of masking. Let's see. I don't know if we actually have that link. Actually, do we? I'm not going to show that particular one, but later on, you can actually ask to see. It's a link from PBS showing that when you wear a mask, it's going to be on the website. When you wear a mask, the respiratory droplets basically stay literally about an inch around you. That's about it. But if you were to not wear a mask and you cough or sneeze, it travels at least 6 feet, if not more. Way more. And there is some amazing photography that actually shows that. And when you breathe, if you don't wear a mask, this cloud of breath is around you, and it actually shows how it works. And if you were someone who is infected, whether you know it or not, and oftentimes the problem is there's a lot of what we call asymptomatic carriers, right? It's a very famous term now. You feel totally fine, and you're breathing, and you're literally shedding viruses all around. The next question is, how does, and you hear the term that we need to be quarantined and self-isolating in a certain amount of time. And what is that number, that number of days, and why those certain number of days? Now, we're still learning a lot about this particular virus, but we have learned a lot already. And what we know is this. Once you are infected, your immune system, of course, immediately tries to fight it and make sure that you're okay, or at least get rid of it, just like any flu, any cold. Basically, this particular virus transmits and acts very similar to the flu virus, right? So, but what we also know is that if you start to have symptoms, by about 10 days, if your symptoms starts to improve, and if you not have a fever for at least 24 hours without using any what we call fever-reducing medicine like Tylenol or ibuprofen, so you're fever-free for 24 hours, and after 10 days, basically your immune system is effective in decreasing killing off enough of the virus that you're no longer infectious. So that's why the isolation and quarantine period, basically isolation, there's a difference between isolation and quarantine, by the way. Let me define that first. When in epidemiology, when you're isolating, that means you're tested positive and you have symptoms, right? And basically, especially if you have symptoms, you're being isolated. If you're quarantining, either you test negative or you don't have symptoms, so you don't know whether you are positive yet. You're waiting for the symptoms to show up, so there's a big unknown of whether you have the virus or not. That's when we want to quarantine you. So you feel totally well, or maybe you even test negative, but there's a chance that you may turn positive later on, and you may show symptoms. That's when you're quarantining. And there's a difference in number of days for isolating and a number of days for quarantining. So let me finish with isolating first. In terms of isolating, you should be isolated. That means you either tested positive, there's a definite positive result, and you could be asymptomatic, but you have evidence that you are positive, or you show symptoms and you show and you are positive. For those folks, you need to isolate for at least 10 days. You can end isolation if, as I said before, you're feeling better. You don't have to be totally recovered, but you feel better. And the most important thing is that you're no longer having a fever for at least 24 hours without using fever-reducing medicine. How do I define fever? Fever is at least 100 degrees or above. Now, CDC might say 100.4 Fahrenheit, this Fahrenheit that is. And the reason why we lowered it a little bit to be about 100 is because right now we're constantly using those thermal guns that you see everywhere. And we've seen that a lot of times using the thermal guns, it's usually about 0.4 degrees. It shows 0.4 degrees lower, when in fact if you were to use a under the tongue type of thermometer, it would show 100.4. That's why we lowered it and said if it shows 100 degrees, you may already actually be having a fever still. So therefore you cannot end your isolation period. You have to be totally fever-free for at least 24 hours. So that's 10 days. Now, at this point, we also are not encouraging anybody to need to get retested again and show negative in order to say that you're totally free of the virus. And the reason why is because by 10 days, and if you're feeling better, basically we trust that the science has shown that the immune system has fought off the virus and has reduced the number of virus and the virility of the virus so that you're no longer infectious to others. Okay, you're no longer infectious to others. The current, what we call an infection rate, or we call it E number, of how much, it's about 1.5. What does that mean? That means if one person were to get infected, that person will infect at least another person and a half. That's why there's an exponential growth of infection going on. It's because it's not just 1-to-1, otherwise that curve would be linear, but it's 1.5. That's why there's almost an exponential explosion of what's going on. So, oops.
Oh, sorry, Dr. Sunny Pak, we have a couple more minutes for you, so please wrap up.
Alrighty, and so therefore, so let me just jump to that on 14 days then. If you're 14 days, basically you have to wait until whether those 14 days you would either turn positive or if you show symptoms, okay? So that's why the quarantine is like that. What are the symptoms then of COVID-19? Is just like any flu-like symptoms, what headache, runny nose, sore throats, even some loss of taste or smell, and or even some GI symptoms like diarrhea. So that's important. Now, finally, the vaccine. The reason why the vaccine is not going to be as great a savior as for the current surge is because it takes 2 shots, right? If it is 2 shots, we know that after you take the first shot, you would get protection of about 55% or more, about 56 or so, at least for the current Pfizer vaccine. Then 21 days later, you would get the second shot, in which case then you'll be protected for about 95%, which means that if 100 people were to get that shot, and you only took the first one, only 55 people would be protected. So we need much more of these people to get the shot right away in order for the vaccine to be able to make a dent on the current infection. That's why currently we still say that we need to continue to be vigilant, cover your nose and mouth, continue to wash hands, stay 6 feet apart, stay home if you're ill, and of course, right now during the holiday season, stay home and let's wait until next year before you get together with your friends and family. Okay, that's it. Hopefully that gives you some general information of how this works.
Thank you so much, Dr. Pak and Victor, for your presentation. Again, the Q&A is open, so please feel free to ask any question. And again, we will answer at the end of the presentation. So our next presenter will be Norm and Kelli from BanCal Property Management.
Thank you, Dr. Pak, and to Victor, and Julie and Danny for the opportunity to address everyone tonight. My name is Norm from BanCal. I have Kelli Smith with me this evening. We'll start by introducing ourselves and our company, and we'll talk a little bit about how we've adjusted our practices and operations to help reduce transmission of the virus at our properties. Here at BanCal, we are, oh, there it goes. Here at BanCal, we're a technology-focused property management company specializing in the management of apartment buildings, HOAs, and mixed-use properties in San Francisco. We realized early on that the importance of adopting technology as a partner to facilitate and streamline operations for ourselves and our clients, because we were much less impacted by the pandemic because we were able to do so. We have 25 team members on our team right now, and we manage 10 others that are offsite on behalf of our clients. So again, it's myself that's on the line today, along with Kelli Smith. I've been in property management for 10 plus years. I started in brokerage and acquisitions, and have been in property management again for 10 plus years. Kelli, you want to introduce yourself?
Yeah, my name is Kelli Smith. I am a senior property manager, rental team lead for BanCal, and I've been with them since 2016 and have been in the industry for over 20 years.
Thank you, Kelli. So in regards to the pandemic, I mean, it's been the talk of the year, right? It's the reason that we're all here today. And the pandemic's affected us as a management company as well as our clients as property owners. So everything that I'm going to talk about today is in the spirit of following the guidance of the authorities and experts like San Francisco Department of Public Health and the CDC. I mentioned earlier about adopting technology to put ourselves in the best place to streamline operations. And doing so early on allowed us to be agile in pivoting our strategy and our operations to ensure that we didn't miss a beat when the pandemic hit. In any emergency situation, whether it's the pandemic or anything having to do with your buildings, we have to develop a plan to be able to continue to provide the best service possible. And again, this didn't change for that pandemic. That planning involves a few steps. Being prepared from the outset to be able to respond to any given emergency, moving into the recovery stage after you respond, and most importantly is learning from the process along the way so that we can prepare for what's coming next. In regards to preparation, we need to draft a plan that'll work, and we've always tasked ourselves with ensuring that that plan meets certain criteria. One of them is being specific, the other is measurable, actionable, realistic, and time defined. These are all important to ensure that anything that we put in place, again, can be measured and can be ensured that is working. So speaking specifically about the pandemic, we need to ask ourselves what the exposure risks are in order to come up with those action items. Once we know what those risks are, we're able to develop a plan. So being faced with a virus that's spreading like wildfire, we needed to determine, how best to reduce the spread amongst tenants, vendors, and our team because we're visiting properties, mainly so that we could maintain efficient operations and minimize impact to our clients and their operations. A lot of people that are on the call today are property owners, and you have to pay your mortgage, you have to pay your insurance. Life doesn't stop, it continues to go on. So our job is to ensure that, again, we're reducing the risk of transmission so that we can continue operations as normally as possible. Once we've developed the plan by identifying the risks, we're able to implement that plan for whatever that desired outcome is. In the case of the pandemic, that means that we're ensuring that tenants had a safe way or have a safe way to pay rent without, exchanging checks by hand or in person. And again, this is where technology really comes into play. Specifically for our portfolio, we have over 90% of our tenants who were already paying rent electronically before the pandemic. So all we really needed to do to pivot and adjust for the pandemic was to reach out to that other 10% and get them to buy into doing it electronically. In addition to not meeting people in person, having them come to our office or putting checks in the mail, we're able to also ensure that we're not losing rent checks because of USPS matters. In regards to keeping tenants, vendors, and our team safe, we've implemented things like postponing non-essential visits to units, implementing sanitizing protocol, as well as masking protocol for ourselves and our vendors that go into buildings. We ask our tenants to do the same as well, and whenever possible, we try to schedule any visits into units when tenants aren't home. One of the most important parts of the response portion of the planning is to communicate with our tenants and communicate with full transparency so they know what our intentions are, they know what measures we've put in place to keep them safe so that we can maintain a calm and controlled leadership position for them. If we're able to do that, they remain calm, they take direction a little bit better that way. So a few of the examples of strategies that we've employed, and I'm sure we'll go into more detail about this during the Q&A session, are we've implemented virtual pre-inspections for units prior to move out so that we don't have to meet in person. Zoom is a beautiful thing, and I'm sure everyone's very familiar with it now. Again, going back to technology, we use the same technology to collect photos and videos of maintenance issues before sending somebody out so that we don't have to make multiple visits into units. In the event that we have to go into a unit, again, we go back to that hand sanitizing protocol, masking protocol for ourselves, our vendors, as well as tenants. In addition, we've implemented more frequent and more detailed cleanings by our janitorial staff at the properties. So again, we talked about recovery. We're not sure when this is going to happen yet. We're not sure how quickly the vaccine is going to help in this regard. But the best thing that we can do is maintain a position of leadership and basically plan for anything else that might come next. So again, going back and learning through this process is what's going to be most important for us so that we can remain diligent, keep everyone safe, and reduce the risk of that transmission that we talked about. Kelli, you want to take over from here with concerns that we're hearing?
Yeah, thanks, Norm. And thanks. And Norm basically went over everything that BanCal is doing to handle this situation as it comes. But owners are concerned what their liability is, and I think one of the things is, well, that BanCal is doing is ensuring that we, on behalf of the owners, are communicating information as provided by the CDC and the San Francisco Department of Public Health. We continue to send out notifications to all of our tenants to make sure that they are, you know, staying informed and also being vigilant. We post notices at buildings, and we make sure that, you know, that they are also trying, that they are following the rules and the guidelines as well. As Norm also stated, you know, when we have maintenance issues that are pending, we're trying to actually, you know, we inform tenants if they're not urgent or anything, and maybe guide them through some of the things that they may consider a maintenance request. Otherwise, if we have to send someone in, we've partnered with our contractors to make sure that they are wearing masks, wearing gloves, following all the necessary PPE that is required, so that we can get you know, pending issues taken care of, but also you know, do it in a safe manner. The other thing is some tenants, you know, have requested or have, you know, concerns about people coming in. So, you know, those are the things that we are determining could be put off, or as Norm also stated, you know, taking a time when the tenant may not be in the unit. And then, you know, the other final thing that we're hearing a lot about is tenants, you know, having difficulty paying rent during this time. We have been able to partner with our tenants to make sure that, you know, they are, you know, we're being empathetic to their situation, but also, you know, knowing that, as you know, that the owner has bills to pay as well. We are working through payment plans with tenants, and have also, you know, worked with SFAA on forbearance agreements that we have worked to deal with certain tenants. And so far, I can tell you that we've had a 98% payment from all of our tenants. So it's been working very well. I think through all of this, one of the main things is communication. It's communication from us, communication from the tenants, and communication, you know, from the city in general as to, you know, what our rules and guidelines are to be followed.
Thank you, Kelly. And I'll add one last thing in regards to the rent. I know there are a lot of property owners on this call, and one of the concerns specifically is rent payments for people that are being impacted by the pandemic. You know, vacancies are never good as an investor or as a property owner. So what we have been able to do, other than the forbearance agreements, is really, like Kelly said, partner with the tenants to figure something out that works for them, whether that's a payment plan, a temporary rent reduction, or a permanent reduction with a renewed lease term. So there are different ways that we're going about it depending on the different needs of our clients and of the tenants. So thank you, Kelly, for that information. That's all we have. All of our contact information is on this slide here. If you guys have any questions, feel free to reach out to us directly, or we're happy to answer any questions during the Q&A. Thank you.
Thank you so much, Norm and Kelly. That's a wonderful presentation. And as a contractor firm or construction firm, we experienced firsthand their professionalism with one of our projects, and that's why we decided that, you know, they're a perfect fit for this series of webinar. So now we have the next speaker, Ken Cofflin. Please let me know if you have remote control.
Yes, I do. Thanks, Julia. Anyway, so I'm going to talk about something I've actually discussed quite a few times over the last 4.5 years. This is regarding the compliance with the fire alarm upgrade, and specifically the sleeping area requirements that came about in 2016. Just a quick history on what kind of brought this out through the Board of Supervisors. It was brought up by Supervisor Chu back in 2016. It came from quite a few fires at apartment buildings and condominiums down in the Mission District. And specifically a death at one of the places, and what somebody had stated that they did not hear the fire alarm As we know that everybody's required to have smoke alarms in their units and their sleeping areas. But those are usually standalone devices that do not connect to the building's fire alarms. So because of these fires in 2016, the Board of Supervisors put ahead some legislation, and actually it was brought up to code an existing requirement that was already in the code when it came to the sound of the alarms. So as you can see right there in 2016, in July of 2016, it was passed. And it said that you had to put sounders in the sleeping areas. And that way, everybody who's sleeping doesn't have to, will be woken, but they would not have to hear from the hallway or somewhere else in the building. It would actually be near the sleeping area or their pillow. So the code says that you need to have 75 decibels there. And they had to come up with a way that, how would they phase it in? And so the Board of Supervisors back in 2016 said that if you spent $50,000 on any construction on your particular building, at that time, you would have to upgrade your fire alarm system, or by July 1st of 2021. Well, 5 years ago, that seemed pretty far away, and now we're down to 6 months. Then there's a little problem with the soft story seismic upgrade. People started getting that confused, and the $50,000, as most of you owners know, that was already exceeded that amount, which caused you not only to do a soft story upgrade, you would have to do the fire alarm upgrade. So the Board of Supervisors went back a year later and changed that, and then made the exception being the soft story upgrade, and kind of pushed it so you wouldn't have the double whammy of doing both requirements at the same time. Changed it that if it was a soft story upgrade or seismic upgrade, it was not counted towards the $50,000. But July 2021 was still a requirement. Actually, at the same time, they added one other requirement or one other trigger, and that would be if you sold or transferred any of your residential buildings after September 1st of 2017. So that means anybody who's done it in the last 2 years should have already had their system upgraded. Just from looking at some of the documents that we received, the statement of compliance, which I'll talk about in a second, I can see quite a few people haven't done this so far. So here's the requirements again. Again, cost of construction $50,000 or more, July 1st, 2021, or 12 months after sale of property. Pretty much everybody's going to hit that requirement come July of this next year. That's very unfortunate because of the COVID situation, what was spoken of earlier about entry into the units, safety, liability. We'll get to that in a second, how we're going to go ahead and do this. But just as the way the ordinance is currently written, this is supposed to be completed in 6 months. One of the other important parts of this, and unfortunately it tends to increase the cost on it, is that the low frequency requirement for the sleeping areas. So the alarm industry did some testing to figure out how do we wake people up, because as fires happen or as fire alarms go off, you hear all the time, I didn't hear the fire alarm, there was no fire alarm, there was no smoke alarms. And what they're finding out is people who may be altered, maybe have a couple of drinks before bed or anything else, don't wake up to the normal sound of what you would hear as a fire alarm. So they did testing, and they actually lowered the waves, the sound wave, to 520 hertz, and they found out they could wake up over 50% more of the people, even if you're slightly altered. So that went into the code back in I believe it was 2013. And so that when you do the upgrade, you actually have to also meet this requirement. The low frequency sounders look like just everything else, but unfortunately they increase your cost. The low frequency sounders take more power. And when your fire alarm is designed, it's designed to use the minimum amount of batteries and wires and power supplies that it can to make the sound go off. But when you add low frequency sounders in the sleeping areas, you most likely have to add additional parts to the puzzle, and that would be additional power supplies. So as you can see, low frequency sounders are more expensive than the mini horns, and also you increase your NAC circuit, which is your notification appliance circuits. Therefore, you increase the number of required remote power supplies. The good news is you only require these particular sounders in the sleeping areas. That would be the bedrooms, any areas that maybe your tenants have converted into a sleeping area. So for some reason, you had a den or an office and it became a sleeping area. You as a building owner would have to actually put a sounder in that area, because the whole entire building will be inspected as part of the upgrade and part of passing the fire alarm test. You say, well, do I need to upgrade my fire alarm system? As you can see, the code is for R2 building, which is residential buildings of more than 2 units. It's 3 or more units, okay? So we get that question a lot. R2, they changed the category of buildings. So just think apartments and condominiums, 3 or more units. R2 used to be hotels and now it's apartments, and they flip-flopped them. So, hey, I don't have an existing fire alarm. Do I have to upgrade it? No, the code is written as if you don't have one, there's nothing to upgrade. So no action is needed. Now, if you have an existing fire alarm with audible appliance inside the dwellings, let's say you have a building fire alarm and you actually have a sounder, it's typically sometimes over the front door on the interior of the unit. If that sounder can make enough noise at the pillow to get 75 decibels, not even considering low frequency, you can get 75 decibels, and you can prove that, you will not need to upgrade your fire alarm system. Okay, so if you don't, let's say existing fire alarm without audible appliance. So if you don't have them in the dwellings, the chances of you getting 75 dBs actually at the pillow are pretty slim. But at that point, what you can do is you can expand your fire alarm system, but you would also need to expand out the low frequency requirements. Okay, so already all new fire alarms that go in, which is typically for the fire code says 6 or more units, they're already being installed as a low frequency fire alarm system. Remember, all work for fire alarms requiring building and electrical permits from DBI. And right now with the COVID going on, trying to get plans through, you need to plan ahead. Permits are not being turned over very quickly. It could take months for you to get to that point. So just to, even if you wanted to have a fire alarm installed by June 1st, you would pretty much have to start now or within the next few weeks. And even at that, I would be very surprised if we could get it turned around that fast. It's not so much the fire department testing of it. We do have limited capacity, but we also have plan check issues and you trying to locate a company to do it. I wanted to talk real quick about the statement of compliance form. Everybody should be sending this form in. It was required since 2016, and it was put out there. The board decided that for transparency, that you should let your tenants know that you are testing your fire alarm system. And this is a form that every 2 years, it needs to be sent into the fire department. We post it on the city website, and then anyone can look it up. So if a tenant had a question, hey, has my fire alarm been tested? It's on there. It runs on a 2-year cycle where 3 to 8 units is 1 year. I believe it's the odd years. And then 9 or more units is the opposite. There's one specific section at the bottom down there that we're using to kind of keep track and send notices out. And that's that compliance. Have you met or have you upgraded your fire alarm system? If your fire alarm company isn't using this new form, you should remind them that this is what needs to be done. I assume we're going to go to the assumption if we're not provided the information, it hasn't been done. So this is a statement of compliance form. There's been some talk out there, there's a lot of issues as well. I don't want to run conduit, which is the piping with the wires on the outside of my building. It doesn't look nice, or I can't do it without it. And it's also could be, pricey to do so. So can I do a wireless system? So they do make wireless systems out there. You just want to make sure that it actually meets requirements and it's UL listed. On our website, on the fire department website, which is sf-fire.org, sf-fire.org. It's been reorganized a little bit due to COVID. It has more COVID information on the main page. But over the next few weeks, they will be changing the site and be easier to locate. But if you go to our administrative bulletins, there's one that's titled fire alarm installation. And that gives you some information. And one of it He's talking about the low powered or the wireless fire alarm systems. Those are remote sounders. They run off of wireless, and they have batteries in them. You have to meet all these requirements. They are a little bit cheaper up front, but in the long term, they tend to cost a little bit more because, as it says right there in item 6, you need off-site supervision with a runner service. So there's a requirement because of the possibility of tampering with them, because your tenants could essentially just pull them off the wall without any wires. It needs a runner service, which means your fire alarm company that you hire actually has to automatically be dispatched out there to troubleshoot any problems. So I just want to let you know there are options out there, wired or wireless. You should discuss that with your company, fire alarm company, and see what the pricing options are for either. Final thing is, what if it's not completed by July 21? I mean, the chances right now, if you haven't started the process, it's not going to. Currently, right now, if we're encountered with it and you have not upgraded, you will receive a notice of violation. That's official documentation that says, hey, you didn't do it and you need to get it done. If you don't comply with a plan of action or the actual installation of it, you may be called to an administrative hearing. At that point, they're going to continue to try to gain compliance. Ultimately, that's what we want for the safety of your tenants. And if that still does not be completed within a time frame, an order to abate will be assigned to your building and therefore be recorded with the assessor's office. We don't want to go that way. We just, this is a process to abate outstanding violations, and not upgrading your fire alarm is one of them. Unfortunately, and I've been preaching this, like I said, for 4.5 years, to get to it early. We weren't expecting this pandemic, and we do understand for the last 9 or 10 months, not much has been done, and you're going to get a lot of pushback. If I've heard recently from tenants about people going into the units and actually testing these particular devices. There is nothing out there that says that, we can force them to. Hopefully, as I think Norm said about doing videos and pictures, that we've done that for a few units where we allow the tenant to actually record it and actually play the video back for the technician as a kind of a workaround at the door without actually having to go into the unit. So we're doing what we can to do the testing. Hopefully with vaccination and things turning around by June, things will change. There is word out there that they may extend the date, but you have to go back to the Board of Supervisors to possibly change the ordinance. It is an ordinance to maybe extend it for another year. I don't know what that is. So there's just been rumors it's out there, but nothing has been presented to date. So we have to go with the assumption that July 1st of this next year, this must be completed. Julia, back to you.
Okay, perfect. Thank you so much for the information. I'm sure a lot of property owners and realtors or professionals in the industry is definitely wondering what is going on with this code. So we want to thank our speakers again for helping us bring awareness and teaching us how to build a resilient framework to emergency preparedness. We will be moving along to the Q&A session. So you can still submit your question at this time. The Q&A button is at the bottom of your screen. So feel free to put in the questions while I'm appointing the questions to the speakers. It looks like we may go over a little bit of our time, so please stick around. Our speakers will be here to answer questions accordingly. Okay, so our first question, since Chief Cofflin, you have just ended your presentation, I will start with you first. Which building are required to comply? And I own a 3-unit, so what are the new fire standards?
So buildings to comply, 3 units or more, in any building with a fire alarm that doesn't meet the minimum requirements of 75 decibels at the pillow. So if you think your building has a fire alarm that can make 75 decibels and wake your tenant up at the pillow, if your fire alarm company can test that and can send us a letter that says it meets the requirements, then you've met the requirement. If not, then you have to comply. So existing buildings, 3 units or more, or R2 buildings, I'm sorry, 3 units or more, apartments or condominiums, that already has a fire alarm installed must comply.
Okay, thank you. So next question will be for Dr. Pak. Why has positivity rate suddenly shot up in December? Is it because of more testing or more infections or both?
It's definitely more, can everybody hear me? Yeah. It's definitely more infection, for sure. That's why I showed that slide earlier about what happened in Thanksgiving. And what we're seeing is the result of a lot of traveling and, probably less 6 feet apart, and therefore more transmission. In terms of testing, there's something what we call case positive rate, and that can show whether it is because of more testing or is it more infection. So let's, for example, if you test 10 people, and at the time when you have less infection, only let's say 2 people are positive. But if for the same rate right now, if you test another 10 people, most likely 8 people are going to be positive, and that means it's actually more of the infection going up. So that is what that means, and we definitely have more infection. Just want to repeat that.
Thank you for the question of the answer. So next question, we'll go back to Fire Chief Cofflin. Can Nest or carbon monoxide module satisfy the requirement using Wi-Fi as an internet?
No. Those don't meet the requirement. The requirements is a fire alarm system. If you have a fire alarm system, the difference is a system, which means it has a panel, which is the brain of it. It has sounders and it has detection. So you need all of those together to make a system. Those other ones are standalone. They're not listed for uses as that type of that. Most of those are smoke alarms, and they are not actually part of a fire alarm system.
Got it. Great. So the next question will be for Norm and Kelli. How are you dealing with maintenance requests?
Nothing's changed in terms of maintenance requests. We still want to be able to process things that tenants request because we want to provide them with a safe and enjoyable home. What has changed is a protocol in regards to how we do that. Again, masking, sanitizing, whenever possible, making sure the tenant's not there so that we, our vendors, or our maintenance staff aren't sharing a space. If it's something very minor, let's just say, I don't know, a bedroom doorknob came off and it can wait, we'll definitely postpone it as long as possible. For any life safety issues that are emergencies, we'll definitely get in there right away because they need to be done. But again, we'll do it with those safety protocols in place.
Okay, thank you. The next question will be Fire Chief Cofflin. Again, so is there any COVID or financial hardship exemptions to the fire alarm requirements? Will this ordinance be extended because of the pandemic? I think that question was semi-answered, but if you want to elaborate a little bit, it'll be appreciated.
There has been nothing proposed for any type of waiver or financial assistance at this time. Again, when it comes to pushing this requirement out a little bit, that I would suggest that you speak to your board of supervisors to possibly get some help during this time. It's not something that would be driven from the fire department. We're the enforcing agency, but I would suggest that I totally understand, because at this point, if you haven't started, it's not going to happen by July 1st unless you really get moving on it. So contact your board of supervisors, see if they can, and if not, find a fire alarm company.
Okay, thank you so much. Next question will be for Dr. Pak and Victor. What do I do if I receive a positive result but asymptomatic?
So I was trying to explain that earlier. For someone who actually has tested positive, they need to isolate for at least 10 days. Okay, so you count by the date that you receive the result. For some cases, it can even be when you get tested. So basically, when you receive the result, just start that date and you count 10 days. The reason why is because then that is usually, you give your immune system the time to get rid of the virus. And during that time, try your best because symptoms can show up at any time during those 10 days. You don't know that. But if you're basically, symptom-free during those 10 days, then that means your immune system is able to fight off that virus. So during that time, please stay away from other people. Make sure that you have your own bathroom, use your own personal items. If someone can actually bring you food, that's even better. And if you have to share something, make sure you clean up what you use afterwards with at least 70% or above alcohol or a dilute bleach solution.
Also, I would supplement that if, let's say,
Victor,
you get
I think
tested.
you're still muted.
Oh, sorry. Thank you. Oh,
Hello? Can you hear me now?
Yes.
So I would supplement by also saying, we know for a fact that if you get tested at one of our city sites at, let's say, Pier 30 or Alamany, we also have resources. The contact tracing and case investigation team will call you, okay, and will give you instructions on what you should do. And if need be, you are unable to, let's say, get cleaning products for whatever reason, if you need assistance for food delivery, if you need specifics for groceries, the city will bring it, and cleaning supplies, very important. Recently, one of my friends came into close contact with someone that was COVID positive because she drove that person for more than 15 minutes. So our CICT team called her up and told her to quarantine for 14 days. And then the city folks brought her all the cleaning supplies and also prescriptions and food to minimize any need for that person to leave the house. We basically do not want that person to leave the house because the rate of reinfection, what is it, Dr. Pax, 1.4 right now? That
1.5.
1.5. That means for every person that is COVID positive, you can infect at least 1.5 other persons. Thank you.
Well, if I may add, basically well, actually, yeah, I'll just leave it at that. That's okay.
perfect. Thank you so much. The next question will be for Norm and Kelli from BanCal. What can I do to a retail space in San Francisco is not paying since March, and the tenant is refused to communicate with us on what kind of help they need?
Outside of working things out with your tenant, if they're not in communication, on the commercial end, you're not as limited in terms of, eviction law. We're not attorneys, so we definitely advise you reach out to an attorney about this. But again, on the commercial end, you can move forward with evictions at this time if that's a route that you wanted to go. What we are seeing in the commercial space, though, is leasing is almost non-existent, especially for retail space right now. So the best road forward that we would suggest is trying to work something out with your tenant, whether it's a payment plan, rent forbearance, reduced rent for a short period of time until things normalize, whenever that may be. But again, what we found is working things out with your tenant is going to be best right now to avoid any vacancy.
Thank you, Norm. So another question for both Norm and Kelli. What kind of impact COVID has on the SF rental market, and do you see an exodus? Sorry, I'm very bad.
The biggest impact that we've seen is in people's practices. So pre-pandemic, especially in San Francisco, given the rising rent rates and the fact that not many people were making enough to have their own unit, a lot of people were sharing apartments. So 2 bedrooms, 3 bedrooms were being shared by multiple people, and even with people living in living rooms. Since the pandemic hit, we've seen a flow of people out of those units and into what are now lower priced 1 bedrooms. So 1 bedroom units are still continuing to move at a relatively normal pace, but studios, 2 bedrooms and 3 bedrooms are very, very hard to move right now. In addition to the fact that people aren't looking at those and are, leaving the city or the urban core for the suburbs, we're also seeing at least a 25 to 35% reduction in rent rates, depending on what neighborhood you're in. We were renting studios, for instance, in the Tenderloin for $2,100 just pre-pandemic, and now we have them listed at $1,200, and they're still not moving.
Thank you, Norm. So we do have couple more questions for Chief Cofflin. If our building's fire alarm doesn't pass the sound requirement, then we need to install a system that meets both the 75 decibels in low frequency. If it passes, then we don't need to meet the low frequency factor.
Correct. Yeah, so it just says that you have to, if you have to upgrade, then you have to upgrade at the low frequency level. Otherwise, you're correct. If it passes, if it's currently installed and it doesn't have it, then you're fine and you don't have to make any changes.
Okay, great, thank you. One last question for Chief Cofflin. If our building's fire alarm doesn't pass the sound requirement, oh, that's the same question. My apologies. So that is all the questions that we have so far. And for the audience, if you guys do have additional questions, feel free to reach out to SGDM directly, and we can try our best to find the answer for you. As mentioned, our recording will be posted on our website at sgdm.com. And it looks like looks like we don't have any more questions. So we want to thank the attendees for being with us today. Ultimately, SGDM is here to support you and bring light to topics that directly affect you and the community. We will continue our webinar series next year, where the next one will be in February. So stay in touch and we'll receive notifications for upcoming webinar and events. And most likely next year we will invite some of these speakers back, and we'll be very excited and we'll be honored to have them back as well. So thank you everyone, and this wraps up the webinar.
Thank you.
Thank you.
Thank you, SGDM, for doing a great job.
Thank you, everyone.
Thank you.
Bye-bye now.